So I'm Dr. Rory McGill. I'm Director of Public Health at Sefton Council, and I'm also the Lead Director of Public Health for the Champs Public Health Collaborative on Suicide Prevention across Cheshire and Merseyside. So day to day, I cover the running and operational management of the Cheshire Merseyside Suicide Action Plan. I'm a gay man, and I have direct experience of experiencing suicidality. In November 2023, I had actually made plans to end my own life. And I'd reached out and got support from my friends, and I describe them as my chosen family, which is a common concept amongst the LGBT community. And I'm so grateful that I did, because I ended up not reaching a further crisis point that potentially could have happened if I wasn't picked up and supported by my closest and nearest and dearest. And I'm really glad that they did kind of notice that I had changed behavior a bit. Because I'm here now to hopefully share my story and help other people potentially in that situation. So I had started losing joy in some of the things that I'd commonly experienced joy through. I'd withdrawn from social engagements, and I'd probably started drinking more as well, I would say. And a few friends had noticed that my behavior had changed. And actually, I've supported other friends who'd experienced something similar, both before and after my own experiences of that. And actually, it does help me better inform how I approach professionally my suicide prevention work, because having a human element to this work's key, because it's quite an emotive topic. I think as well, it's really important to acknowledge that for someone that might be experiencing suicidal ideation, there can be a lot of shame attached to that. There's still this common language around suicide that it's very selfish and that person wasn't in the right mind, but actually, having direct experience of that and supporting other people with this, it can actually be a place where someone feels that there's no other way out and that other people would be better off if they simply did not exist. Now, that isn't something that can easily be put across in a 2-second conversation. What we need to do is help destigmatize discussions around suicidality. So whenever we think about the LGBTQIA+ community, it can be really easy to think about everyone within that umbrella being the same. And that couldn't be further from the truth. I am a gay man with lived experiences associated with that, but that will be vastly different to a Black trans woman. And we can't make those assumptions that one size fits all with the LGBTQIA+ community. Now, what that means is we need to start embracing intersectionality, I would say, so start thinking about other things that make up someone's life experience. I'm not just gay, I'm also a man. I'm cisgender, I'm Irish. Within all of those experiences will come cultural milestones within which I might have felt othered, but that's not going to be the same as someone with trans lived experiences. And in the current climate that we're in, unfortunately, those members of my community might be facing more adverse situations than myself. So I do think that there's a responsibility for us all to look out for each other, but particularly within the LGBTQIA+ community, one size does not fit all and could actually create more harms by making those assumptions. So a common concept within the LGBTQIA+ community is chosen family. And what I mean by that is it's a family through choice, not obligation. I think that the common narrative and what people conceptualize when you think of family is your biological family. And obviously it's really ideal if your biological family are very supportive of you. But unfortunately, we know through national statistics and local lived experiences that sometimes biological family can reject family members who are part of the LGBTQIA+ community for a variety of different reasons, mostly associated with stigma and shame. And what that can do is make someone very vulnerable. But chosen family are people with shared experiences, most likely other members of the LGBTQIA+ community, but also allies who just want to help and support people who have those lived experiences. And what it means is there's not that need to keep reintroducing yourself, to keep re-stigmatizing yourself. Chosen family provides safe spaces through in which you can be your full self. And I think it's safe to say if someone can be their full selves, they're at their most potential to feel well. And when you take that away from someone, unfortunately, that's when you can introduce that low mood and the potential risk for encroaching suicidal thoughts. So I would say if you're really close with someone, there's a concept of knowing someone's normal. And I would always think of that in the same way of you've got your best mate that you see twice a week, or you've got that loved one that you would talk to on the phone multiple times a week. You'll know if there's something off with that person. It's really difficult to put into words, but I'm hoping that whenever I say that, people understand what I mean by that. When I've supported friends in the past who have experienced suicidality, and myself when I've been supported by friends, some of those trigger points would have been very subtle to people that didn't know them, but to someone that is in their chosen family or someone in their immediate circle, that would have felt like a bit of a strange interaction. And I think it's about keeping vigilant to that and being aware of how your loved ones are acting. So if I was to give anybody advice about if they're worried about someone and they think that they mightn't be okay, I would offer to speak to them in a way that didn't seem like it was a formal intervention. So whatever you already do with that person, do that common activity, but make sure it's a calm and quiet space and ensure it's private. And just ask them in a candor or a language or a way that you communicate if they're feeling okay. But be comfortable with the fact that if they are hesitant to talk about it, just don't try to fill the gaps and don't try to fix them in that moment. One conversation can save a life. It saved mine, it saved my friend's life, and who knows, just spending a small amount of time going through some of this information, you might then feel better equipped to save someone else's.